everyone, I'm Ayesha Ferdowsa as Dani from Bachelor of Science in Hospitality Management, 3rd year, Block A. So I am the first reporter for this topic entitled Sexual Behaviors. Before I'll start, I just want to remind you, especially to those conservative one, that this topic is very sensitive. I just want you to be all open-minded. So, what is behavior? In simple terms, it refers to actions, okay? Behavior is the way in which one acts or conducts oneself, especially towards others. And these are things that we do both overt or observable and covert or not too readily observable by the naked eye. So, behavior is the manner of behaving or acting, both overt means observable, shown openly, not a secret or hidden. Okay, while covert is readily not observable, okay, not acknowledged openly, not displayed. That is the difference. Depende yun kung anong behavior ang gusto nating ipakita. Let's proceed to sexual behaviors. These are actions that humans agree to interpret as an expression of their sexual motivations or intentions. Okay, sexual expression or intentions. It can be both positive or negative, depending on the sexual interaction that is involved. Okay, example of the positive, fulfillment, making love, okay, the authenticity, sexual intimacy. Sa mga mag-asawa or yung mga legal na nakakagawa ng mga sexual intercourse, ganon. While sa negative, yung mga sexually abused, okay, the aggressive outside the range of normal sexual development, okay, yung rape, ganon. Next, homoerotic behaviors are sexual behaviors oriented to the same sex. So homoerotic behaviors, it is a sexual interest, okay, acting on the same sex, okay? Kaya nga meron tayong LGBT community, diba? So sa gay, ang tawag nila is homosexual pag sa lalaki. Pag sa babae naman or lesbian, homosexuality. Kaya nga doon sila na tinatawag na homoerotic behaviors. So next is the heteroerotic behaviors are used to refer to sexual behaviors oriented to the other sex. So kanina, homoerotic, sexual interest in the same sex. Ngayon naman, yung heteroerotic behaviors is the behaviors oriented to the other sex. Okay, sa babae, sa lalaki, ganon. So, for reproductive purposes, copulation or the insertion of the penis to vagina is necessary. Okay, for reproductive purposes naman, copulatory means the insertion of the penis to vagina. Okay, humans can assume two positions in this process. Okay, while doing the sexual intercourse, meron tayong tinatawag na ventral position, which is the face-to-face or belly-to-belly. Yung harap-harapan kayo naghaharap-harapan kayo ng partner mo. That is the ventral position sa sexual intercourse. While yung isa naman is the ventral dorsal position, it is the opposite location, the back portion of the body. Yung nakatalikod ka, tapos sa likod mo, yung partner mo. So, sexual behaviors do not only refer to copulation. They also include non-ovulatory sexual behaviors. So, in sexual behaviors, hindi lang naman necessary yung copulation or copulatory, the insertion of the penis to vagina. They also include non-ovulatory or the non-copulatory sexual behaviors, which is without inserting the penis to vagina. Okay, for example, genital masturbation, okay, oral sex, ganon, yung non-copulatory. Now, let's proceed to sexual response cycle. Okay, for heterosexual couples, one of the ultimate goals of the sexual act is reproduction. Okay, as I've said earlier, yung heteroerotic, okay, it is necessary for them to go on copulation. Okay, so before this ultimate process, both the human male and female undergoes a sequence of bodily changes which prepare them for the sexual sexual climax. Okay, this sequence changes is referred to as the sexual response cycles. Okay, in sexual intercourse of the both female and male, okay, merong sexual response cycles na tinatawag. For sexual response cycles on heterosexual, no, in Master and Johnson's model, there are 4 phases. First is the excitement phase. In this phase, no, while doing the romance, the male is the role of the male is the erection, okay, the hardening of the penis, while yung sa female naman is the lubrication. The vagina is making it wet and ready for the sex. The second is the plateau phase. Okay, in this phase, the heterosexual having already their sexual intercourse. So, the breathing becomes more rapid, the heart circulation will increase, and also increase in sexual pleasure. The male, in male, the corona and grand penis will become enlarged and reddish, while sa female naman, the outer vagina swells and the inner vagina expands. Next is the orgasm phase or the climax. Ayan, the final stage of succession. Okay, this is the shortest of the phases and generally lasts only few seconds. Blood pressures, heart rate, and breathing at the highest rate. Okay, ito yung tinatawag na a sex flash dito sa orgasm phase. And the last phase is the resolution phase. Okay, this is where the penis and the vagina will relax and back to normal. Okay, the heartbeat, the blood pressure, the breathing will come back to its normal beating. This is the end of my topic, no? So Mr. Pacquiao will continue to discuss the remaining topics in sexual behaviors.
Thank you so much for that, Mrs. Danny. So good morning, everyone. Before I'm going to proceed to the formal discussion about the lesson 11, which is the sexual behavior, let me first introduce myself. By the way, my name is Jason Mosso Pacquiao, a third-year student of Bachelor of Science in Hospitality Management, Black Sea. So let's proceed to the topic, which is the Kaplan's model. Kaplan's model. Unlike Master and Johnson's model, Kaplan's model sees the sexual response cycle as having relatively independent stage. These 3 phases of this model include: first is the desire. Desire is the psychological component of the sexual response. It involves sexual thoughts and feelings. So according to Kaplan, desire was viewed as a precondition for subsequent sexual excitement, arousal, and orgasm, thereby remaining the linearity of the sexual response cycle. The second is the arousal. Arousal is the plateau, is the part of the sexual response where bodily changes occur as a result of the physical and psychological stimulation. So the plateau phases intensifies the responses from the excitement phase. Breathing, blood flow, and heart rate continue to increase and stabilize. Muscle tension increase and may extend to hands, feet, face, and other areas of the body. In women, as blood flow increases, the vaginal walls darken and the clitoris becomes increasingly sensitive. The vagina expands and the uterus becomes fully elevated. The Bartholin gland produces additional lubrication in and around the vagina, while in men, the rush of blood causes penile erection and enlargement of the testes, with the scrotal sac pulling more tightly toward the body. And the third one is the orgasm. In Kaplan's model, is generally similar with that of the Master and Johnson's model, except that this phase also includes the resolution phase. This is the completion of the sexual response. The orgasm phase represents the peak or sexual climax of excitement, though not all men and women necessarily reach this stage. Orgasm is marked by involuntary, rhythmic muscle contraction throughout the body as well as sense of euphoria and feeling of tension relief. The last phase is the resolution, marked by a return to baseline, muscle relax, blood pressure drops, and respiration returns to the pre-arousal state. Blood flow to the genital region decreases, and erectile tissue return to normal. So, before we proceed to the next topic, please have time to watch this short video about the sexual response cycle.
This is Casey, this is Alex. These two lovebirds are on a date, and because they are so in love, just looking at each other stimulates the brain into releasing feel-good chemicals like dopamine, the same chemicals that are released in response to cocaine and nicotine. So what happens next is brought to you by the limbic system. That's the part of your brain that's responsible for keeping us humans alive all these years. It controls our fight or flight response, our emotions, our desire to eat. It also makes us want to reproduce, i.e. have sex, which is exactly what these two are about to do. So let's look at the first step in the process: excitement. Casey and Alex start smooching. Their lips are packed with highly sensitive nerve endings, 100 times more than their fingertips, so even a peck sets off fireworks in their brains. Both of their nipples get hard. Blood flow increases to Casey's penis, making it stand at attention. Alex's vagina is getting in the mood too, and increased blood flow causes it to swell. At this point, their brains are suppressing the stress-causing hormone cortisol, so all those "did I lock the door?" and "is my presentation ready for tomorrow?" all those thoughts, they are gone bye-bye. Heart speed faster, breathing quickens, cheeks get flushed, and their bodies start producing up to 30% more immunity-boosting chemicals. So now it is go time as they enter the plateau stage. Once penetration occurs, Casey's heart rate rises to about 130 beats a minute, which is the same as if he had just climbed 2 flights of stairs. Alex's hippocampus is going bananas, as is the part of her brain associated with intense feelings. Their skin's electrical resistance increases to heightened sensitivity, and even their stomachs are at work. Gastric acid increases, which might explain why Casey kinda wants a huge sandwich once they're finished. After 3 to 10 minutes, the average sexy session time, and yeah, I know, right? 3 to 10 minutes, that's it. Both Casey and Alex's bodies are on full sensory overload. Alex's nerve and muscle tension builds up through her vagina, butt, and thighs until a single moment when all that business below the belt contracts at the same time. That means she's hit a stage 3 orgasm. These muscular contractions occur literally faster than you can blink. Alex's brain is now pumping her full of dopamine and releasing oxytocin, which some people call the love hormone. Casey is having a different experience. First, contractions force semen into the urethra. Next, the prostate gland secretes a fluid into the semen that improves the movement of Casey's little swimmers. Then the urethra, penis, and prostate gland all contract in unison to shoot the semen out of his ding dong. Casey gets such a hefty cocktail of other brain chemicals that rational thinking is actually deactivated. Among these chemicals is one that makes him really sleepy, so note to his lady friend there, if he falls asleep after the deed, it's not you, and he can't help it. All of this intense activity lasts just 15 seconds, after which they both arrive at stage 4, resolution. Their breathing and heart rate slowly return to normal. Blood is pumped away from their sexy bits. They bask in the glow of endorphins and feel-good hormones and talk about moonbeams and ice cream or whatever's on their mind at the moment, or more realistically, fueled up with that oxytocin, which is also known as the cuddling hormone. Alex tries to snuggle while Casey wants a nap and or a sandwich. But wait, we're not done. Alex and Casey were nowhere near the only ones getting busy on Earth. Some research estimates that on any given day, 120 million people are having sex. On any given day. 120 million people. That's a lot. Either way, if these two were trying to make a baby, then Alex's body has to take it from there, and, well, that's a whole other story.
Alright, thank you for watching the video about the sexual response cycle. And hopefully you've learned a lot from that video, and this time let's proceed to the next topic, which is the sexual response dysfunction. So what is sexual dysfunction? So according to Google, sexual dysfunction is a problem that can happen during any phase of sexual response cycle. It prevents you from experiencing satisfaction from sexual activity. And the following are the common sexual response dysfunction. First is the sexual desire disorder, or when an individual has low level of desire or has an aversion to sexual activities, or lack of sexual desire or interest in sex, gaya na lamang ng isang magnobyo at magnobya, na kahit anong gawin ng lalaki sa babae, hindi niya ito magawang romansahin or akitin dahil na lamang sa ang babae is wala itong gana or wala itong interes na makipagtalik sa kanyang nobyo. Second is the sexual arousal disorder. When an individual has problems in achieving necessary psychological state or copulation, or in addition, inability to become physically aroused or excited during sexual activities. Yes, gaya na lamang sa mga kalalakihan na kahit anong gawin ng babae is hindi available si John ngayon. Kung kaya't wala silang hindi siya in line sa sexual na mga gawain. And the third one is the orgasmic disorder, when an individual has problems in achieving orgasm, or delayed or absence during orgasm or in climax. Yes, most likely sa mga kalalakihan na kapag ito ay lasing, na kapag nakikipagtalik sila sa kanilang mga asawa na lasing, is may tendency talaga na matagal silang lalabasan or matagal nilang makakamit yung heaven or climax. And the fourth is the sexual pain disorder, when there is an experience of pain during the sexual response cycle or pain during intercourse. Yes, lalong-lalo na sa mga kalalakihan na kapag nakikipagtalik sila na mahigit sa 3 sa isang araw is mararanasan talaga nila yung pain na nagdudulot ng sakit mula sa kanilang mga junjun. So next topic is all about the paraphilias. Paraphilia is when an individual gets sexually aroused by an object, a person, or a circumstances that are unusual. While there are typical sexual behavior among humans, there are also those behaviors that are relatively atypical. They are atypical due to any of the following reasons. First is they are not prevalent. Second is they are dangerous to self, to others. Third is they are bizarre and are not socially acceptable. And the fourth is they are distressing either to the doer or to the other people involved in the act. A paraphilia disorder is when the urge or act lasts for at least 6 months and is a manifestation of clinically significant distress. Some of the common paraphilias disorder are the follows. Exhibitionism. Exhibitionism is characterized by intense, sexually arousing fantasies, urges, or behaviors involving exposure of the individual's genital to an unsuspecting stranger. The individual with this problem, sometimes called a flashers, feels a need to surprise, shock, or impress his victims. So the exhibitionism is usually they are males exposing their genital, usually to an unsuspecting stranger, and become sexually excited when doing so. They may be aware they need to surprise, shock, or impress the unwillingly observer. The victim also almost always a woman or a child, either sex. Second is fetishism. Fetishism is use of an inanimate object or the fetish as the preferred way to produce sexual arousal. Fetishism is a form of paraphilia. People with fetishes may become sexually stimulated and gratified in various ways, such as the following: wearing another person's undergarments or wearing rubber or leather. And the third one is the voyeurism, is the act of touching or rubbing one's genital up against non-consenting person in a sexual manner. Like for example, a person who is suffering from futurism usually experience symptoms such as intense sexually arousing fantasies, sexual urges, or behaviors involving touching and rubbing against a non-consenting person for over a period of the last 6 months. And the fourth is the pedophilia. Pedophilia is a person who has sustained sexual orientation toward children, generally aged up to 13 or younger. So according to Blanchard, not all pedophilias are child molester or vice versa. Child molester are defined by their acts, pedophilias are defined by their desires. And the fifth is the sexual masochism. Sexual masochism is intentional participation in an activity that involves being humiliated, beaten, bound, or otherwise abused to experience sexual excitement. Sexual masochism disorder is sexual that causes significant distress or significantly impairs functioning. The sixth is the sexual sadism. Sexual sadism is infliction of physical or psychological suffering, like for example, humiliation or terror, on another persons to stimulate sexual excitement or orgasm. Sexual sadism disorder is a sexual that causes significant distress or significant function impairment or is acted on with non-consenting person. And the seventh is the transvectic fetishism. Transvectic fetishism is having a sexual erotic interest in cross-dressing. And the last one is voyeurism. Voyeurism is observing other people engage in sexual activities. So in other words, voyeurism is the practice of gaining sexual pleasure from watching others when they are naked or engaging in sexual activities. And that's it. And so before I end this topic, please do watch a short video about the paraphilia for you in order to gain more knowledge about it.
These are all the typical sexual attractions and behaviors. Then what is all this around it? They're called paraphilias. Para meaning besides, and philia referring to love. You may be thinking, isn't this a fetish? Fetishes are a type of paraphilia. It's attraction to body parts or inanimate objects. It's kind of like in geometry, the way that a square can be a rectangle, but a rectangle could not be a square. Fetishes are the square. There are lots of fetishes. There are over 500 paraphilias. 500 plus ways that people experience love and pleasure beyond this. Pornophilia is erotic interest in turning someone into furniture. Don't worry, Stefan, I'm not going to skin you. Someone making obscene phone calls for erotic pleasure is called telephone scatology. This is not to be confused with another paraphilia known as scatology, referring to arousal by feces, better known as coprophilia. We're not going to demo that. The sexual desire to dress and act like a baby is paraphilic infantilism, or the adult baby syndrome. Trichophilia is specifically the diaper, a diaper fetishism. Plushophilia is attraction to stuffed animals, the toys, not the taxidermy. Kleptophilia, stealing for pleasure. Oculophilia, breast fetishism or masophilia. Pygophilia, the butt. These are all different types of partialisms, a type of fetish where it's for a specific non-genital body part. The most common paraphilias are frotteurism, rubbing on a non-consenting person. Sadism, pleasure from inflicting pain. Masochism, pleasure from the pain, which can also be psychological. Transvestic fetishism is wearing the clothing of the opposite sex. Exhibitionism is exposing oneself. Voyeurism, watching others undress, be naked, or having sex. Antagonistophilia. The seventh of the most common paraphilias is pedophilia, sexual arousal, attraction, and gratification derived from prepubescent kids. This is not to be confused with hebephilia, which is early to mid-puberty, or ephebophilia, which is late puberty. This book, well, the professionals and scholars that put it together and the preceding editions, has the say on when a paraphilia is unhealthy. The psychiatric community uses the Diagnostic and Statistical Manual of Mental Disorders to evaluate clients and patients. For short, it's called the DSM-5. It's a guidebook for a lot of mental disorders. It's also the guidebook to determine when a paraphilia is disordered. Mainly answering the question, is it causing or risking harm, impairment, or distress to anyone? If yes, get treatment. If no, confirm consent. Even when a paraphilia isn't harmful, it can still be qualified in a variety of ways. One system describes 3 levels: paraphilias that are optional, preferred, and exclusive. Optional, which is kind of a take it or leave it system. Preferred, where the person would rather incorporate the paraphilia into their sex play than not. And exclusive, where the only means of sexual gratification, attraction, or arousal are going to come when that paraphilia is present. If paraphilia is not there, not getting off. My hope is that with increased awareness about paraphilias, people won't be ashamed of their differences or their requests for something specific. They'll get help if they need it, and they'll meet communities that understand them. Paraphilias, no shame. The website fetlife.com is a community where this is already the reality. Link below. Let us know which paraphilias are most intriguing to you in the comments, and stay curious.
Okay, thank you for watching the video about the paraphilia. And before I end my report, let me read the note about the paraphilia. For a paraphilia to be considered as paraphilic disorder, diagnosis has to be made. Only trained psychologists or medical doctors can make such clinical judgments after lengthy and comprehensive assessment. So that's what we all. Thank you.